Hello and welcome to the 8th episode of the Innova Biosciences webinar series. Today's webinar, Applications and Advantages of Alkaline Phosphatase in Immunoassays, will discuss the key benefits associated with using alkaline phosphatase as the enzyme of choice in an immunoassay. Traditional alkaline phosphatase conjugation methods have historically been complex and unreliable, causing researchers to shy away from this particular enzyme regardless of the advantages it provides. Our speaker today is Dr. Andy Lane. Andy has more than 25 years of experience in working with antibodies and preparing antibody enzyme conjugates for use in immunoassays. His background includes a period in the diagnostic sector and then with the leading research antibody manufacturer, overseeing both R&D and manufacturing of antibodies and conjugates. During today's webinar, he will discuss the nature and characteristics of alkaline phosphatase, advantages of AP in immunoassays, choice of substrates available, and how to prepare antibody AP conjugates.
Great. Thanks, Claudina, and good afternoon or good morning to everyone, depending on where you are. I'd like just to start, as Claudina outlined, by thinking about the nature and characteristics of alkaline phosphatase a little bit. You'll see from the diagram on the left-hand side of this screen that AP is a dimeric enzyme. It's actually 140 kilodaltons in size, certainly in the most commonly used form. Quite importantly, AP has interactions with both zinc and magnesium ions. Each subunit binds two zinc ions. One of those is bound very tightly, and one of them rather less tightly, and it's that one that is involved in the catalytic reaction. I.e., if it's not there, the catalytic reaction is slowed down or won't progress. Magnesium ions are also bound by alkaline phosphatase. They're at different sites to the zinc ions, and they're also involved in stimulating the catalytic reaction. Excess zinc actually can displace magnesium ions, and interestingly enough, can inhibit activity. The role of zinc and magnesium is obviously therefore important in activity of alkaline phosphatase, and you'll find that people will have zinc and magnesium within their buffers for any antibody alkaline phosphatase conjugates that they use. Thinking a little bit more about the characteristics of alkaline phosphatase, it's not a single enzyme, it's a family of enzymes, and it's very, very widely distributed. The functions of alkaline phosphatase are given away precisely by its name. It's a phosphatase enzyme, and it works to hydrolyze phosphate groups away from nucleotides and proteins. The alkaline part of the name purely reflects that it is most active around about pH 8. In mammals, there are two key forms of alkaline phosphatase. One of them is very, very widely distributed in virtually all tissues, and the other is actually restricted to the intestine. The two different forms react differently to inhibitors. Tissue alkaline phosphatase is actually inhibited by 1 millimolar levamisole, whilst intestinal alkaline phosphatase is not. That's actually very useful, especially in immunohistology reactions, where you can use the different inhibition to block endogenous alkaline phosphatase activity. The most commonly used form of AlkPhos in immunoassay is indeed calf intestinal alkaline phosphatase. However, you can have sources from other tissues. Another common one is placenta, and there are now also recombinant alkaline phosphatase enzymes available. Just like to take a slide to think about some of the advantages of alkaline phosphatase in immunoassays and in immunohistology. In contrast to enzymes such as horseradish peroxidase, alkaline phosphatase reaction rates actually remain linear over a long period, and therefore you can very easily increase assay sensitivity purely by the very simple step of increasing the reaction time with the substrate. Alkaline phosphatase is not inhibited by byproducts of the substrate reaction, which can be an issue when you use horseradish peroxidase. AlkPhos can in fact be inhibited by phosphate that is generated during the substrate reaction, but actually only at levels that effectively you will never reach during that reaction in any immunoassay. Horseradish peroxidase, in contrast, actually undertakes with some substrates a so-called suicide reaction, whereby some of the products of the reaction inhibit the horseradish peroxidase enzyme, and therefore substrate generation is limited over a fairly short time period. Another key advantage of alkaline phosphatase is that its activity is not affected by exposure to the most commonly used antibacterial reagent in immunoproducts. Sodium azide is the product that is used in probably 80 or 90% of antibody preparations, and sodium azide strongly inhibits horseradish peroxidase. The alternative to sodium azide for use with HRP conjugates are generally mercury-based preservatives such as thiomersal, and they obviously have their own problems from a health and safety perspective, and indeed are not permitted in some countries around the world. In immunohistochemistry, alkaline phosphatase offers a very useful alternative to HRP, especially where levels of endogenous peroxidase can be high in some tissues. As I've already mentioned, endogenous alkaline phosphatase activity can simply be blocked by the inclusion of levamisole in the buffers. I'd just like to spend a few moments talking about the choice of substrates for alkaline phosphatase, which is obviously an important issue if you're using the enzyme in an immunoassay situation. I'd like to start with the simplest and most commonly used substrates, the so-called chromagenic substrates. These are available in two main forms: the precipitating substrates, which, as the name suggests, result in an insoluble reaction product being produced, and they're particularly used for immunohistochemistry and Western blotting, and then the soluble substrates as used in immunoassays such as ELISA. Chromagenic substrates are certainly the simplest and therefore the most cost-effective substrates that are available. They do have lower sensitivity than some of the other substrates I'll mention in a moment, and are therefore best suited to assays where protein expression is relatively high. Chromagenic substrates are probably used in 80% or more of assays. A key advantage of these substrates is that it's possible to monitor color development. You can actually watch it appearing in front of your eyes, and therefore it's easier to optimize conditions for an assay. Typical precipitating substrates for alkaline phosphatase are BCIP and NBT, which provide a blue or a purple readout. Another one that I've not mentioned on this slide is the so-called fast red, which, as its name suggests, gives you a red readout in immunohistochemistry. The most commonly used soluble substrate is PNPP, which gives you a yellow signal. The next type of substrate to mention are the chemiluminescent substrates. The key advantage of these substrates are their extremely high sensitivity and also their very wide dynamic range. The light emitted by these substrates is only present when the enzyme-substrate reaction is ongoing, and therefore you don't get any permanent colored product produced. You therefore need specialized equipment to measure the chemiluminescent signal. A key group of the chemiluminescent substrates for alkaline phosphatase are derivatives of 1,2-dioxetane. The remarkable thing about these is their sensitivity. You can gain sensitivity in the attomole range, and there are indeed reports of single molecule detection in 100 microliter samples using some derivatives of these substrates, and you really can't get any better than that in terms of sensitivity for your assays. Another choice of substrate is your fluorescent substrate. They're also available for use with alkaline phosphatase, also have high sensitivity, around about the same sorts of levels as most of the chemiluminescent substrates. Typical substrates include 4-MUP and the more sensitive BBTP, which again provides sensitivity in the attomole range. One interesting substrate to give particular mention to is the so-called Duolux product, which has both chemiluminescent and fluorescent properties. The fluorescence of Duolux may actually be measured months after the luminescence has faded, giving you a long-term readout possibility, and that might be especially useful if you want to take images of applications such as Western blot. You can actually come back days or weeks later to take an image having had a quick look at your results on a chemiluminescent basis. So we've talked a bit about advantages of alkaline phosphatase and some of the substrates that you can use. Obviously, to be able to use alkaline phosphatase in immunoassays, you need to be able to conjugate the enzyme or link it to antibodies. And with the advantages that we've talked about, you'd think that it would be relatively commonly used. However, it's a relatively difficult enzyme to work with in terms of conjugation. It's not unusual to find losses of enzyme activity following conjugation. Specific activity of alkaline phosphatase itself can also vary very widely from batch to batch. And indeed, a number of suppliers actually offer alkaline phosphatase at different grades based on the different specific activities. Also, at a very simple level, the fact that alkaline phosphatase is colorless and you can't actually see it during a conjugation reaction tends to make life more difficult. Traditional conjugation techniques to link alkaline phosphatase to antibodies or indeed other proteins include cross-linking with homofunctional linkers such as glutaraldehyde, and also the application of heterobifunctional cross-linkers such as SBDP and SMCC. There are also some reports of periodate-based conjugation methods, although they're not used that commonly. Glutaraldehyde-based conjugation of AP to antibodies is actually an extremely difficult reaction to control. You simply end up cross-linking alkaline phosphatase to antibodies in an uncontrolled manner, and the biggest difficulty is in preparing consistent conjugates from batch to batch. In contrast, methods that use the heterobifunctional cross-linkers, the SBDP and SMCC, do provide better control. However, these do require significant experience of chemistry and an understanding of the variables that might affect those reactions, as well as expensive protein purification systems to purify the resulting conjugates. A much simpler option for conjugation of alkaline phosphatase to antibodies is offered by the LightningLink conjugation kits offered by Innova Biosciences. And I'd just like to take a few slides to introduce the LightningLink kits from Innova and talk through how they can be an advantage, particularly in dealing with alkaline phosphatase conjugate preparation. The kits themselves are the world's fastest, easiest to use, and indeed most efficient conjugation technology that's available. You literally only need 30 seconds of hands-on time to prepare a conjugate. And although we're looking at alkaline phosphatase today, we actually have more than 50 different forms of LightningLink kits available that enable you to link antibodies to other enzymes, fluorescent dyes, and proteins. In using a LightningLink kit, you simply add your antibody to a freeze-dried dye or enzyme and then incubate it for a period of time, and after that period is over, your conjugate is ready to use. Looking at this in a little bit more detail and some of the advantages of LightningLink, one of the key advantages is the 100% antibody recovery that you get. In comparison to most traditional techniques, LightningLink doesn't require any separation of unconjugated antibody and enzyme at the end of the process, and therefore at the end of the reaction you have exactly the amount of antibody that you started with, but it's now conjugated to the enzyme. LightningLink is fully scalable. We sell kits that allow you to conjugate as little as 10 micrograms of antibody, but we can also scale this up and manufacture batches in excess of 1 gram of alkaline phosphatase antibody conjugates. The simplicity of the kit virtually eliminates batch-to-batch variability, and indeed allows you quite easily both to label to antibodies and other proteins or molecules. The bond itself is a covalent bond, and as I mentioned before, it's a simple reaction, and for alkaline phosphatase is complete within 3 hours. The slide on the screen now shows some comparative data comparing the effect of using LightningLink to conjugate alkaline phosphatase to an antibody and a traditional technique. What we've undertaken in this experiment is to buy a commercially available antibody that recognizes human IgG and to conjugate that antibody to alkaline phosphatase using a LightningLink kit. At the same time and from the same supplier, we've purchased a pre-conjugated version of that antibody. If you look at the top slide, you can see that as we dilute out the alkaline phosphatase conjugate, the red line is the LightningLink generated antibody and the blue line is the commercially available conjugate. And you have much higher OD readings and therefore more sensitivity and the possibility to dilute the LightningLink conjugate further than the commercially available material. Using the same data but just expressing it differently, at the bottom with the conjugates at a 1 in 10,000 dilution, you can titrate the amount of antigen per well on the x-axis, and you can see that with the LightningLink generated antibody you can get more sensitivity and detect less antigen per well than you can with the commercially available secondary antibody. If you're going to use LightningLink, there are just a few considerations that you need to think about. The main one, of course, is to remember that the kits are very, very simple to use, but you do need your antibody in the right format to work most effectively. It's best to have your antibody at a concentration of 1 milligram per mil, and it's also very important to make sure that your antibody is pure, i.e. that any other proteins have been removed from the antibody before you go ahead with the conjugation. Also make sure that protein-based stabilizers haven't been added back. One of the most common is bovine albumin, which is used by many commercial antibody companies as a stabilizer. And please make sure that that hasn't been added back into your antibody preparation. The buffer formulation for your antibody is generally fairly straightforward. The most common formulation is a phosphate buffered saline, and that's absolutely fine for using with a LightningLink kit. Do make sure that there are no amines such as glycine present, and also make sure no phiols such as DTT or mercaptoethanol. Tris at relatively low levels in your buffer, up to about 20 millimolar, won't inhibit the reaction. If you're interested in using LightningLink kits for labeling proteins other than antibodies, that can easily be done. If you know the size of your protein, all you have to do is adjust the amount that you add so you end up with the same molar ratios. And just to summarize and think about the applications of alkaline phosphatase conjugates, by combining the advantages of alkaline phosphatase with the simplicity of LightningLink kits, we've seen a rapid and now a sustained increase in the use of alkaline phosphatase, both by researchers and also by commercial assay manufacturers over the last year or so. Alongside our catalogue offerings, we can also make available bespoke size conjugation kits for people, and we can also provide custom conjugation services. So we can provide the full range of services for anyone who's interested in preparing alkaline phosphatase antibody conjugates. I won't read through word for word the testimonial at the bottom of this slide, but this is just one of several testimonials that we have available on the website from customers who have used our kits. And in this particular case, there's a researcher who's been using alkaline phosphatase conjugations to study his anti-HIV antibodies, and finding that he's able to proceed with his assays much more quickly and with very good result.
Okay, thank you, Andy. I'm afraid that that's all the time we have today. Keep an eye out on our social media channels where we will soon be advertising our upcoming webinars. And if you would like to receive a PDF copy of the presentation or a link to the video recording, please contact me. You can find my contact details on any of the webinar emails you've received. So we'd like to thank you very much for joining us today. We hope that you enjoyed the webinar and that you'll be able to join us for our next webinar in a month's time.